Doctors at UAMS are pleading with the public to help open up hospital beds. Besides getting the vaccine, doctors say many COVID-positive patients can get a special infusion that can help minimize the symptoms. Jessica Rank is live outside UAMS. Jessica, tell us about this infusion that's available for folks.
Yeah, Donna, well, it was originally offered to just a small group of people who were considered high risk for the virus, but now hospitals are opening it up to more. Now, it is supposed to lower symptoms, but it's also supposed to decrease the risk of a possible hospitalization by almost 70%. Karen Sullivan is spending her last few weeks of summer vacation inside.
I tried to do all the right things, got the vaccine, tried to do what I was supposed to do.
Sullivan tested positive for COVID-19 last week.
Don't know where it came from or how it happened, so that was hard.
She says her symptoms were mild, but doctors still suggested she get what's called an antibody infusion.
I'd heard about them before, but I didn't know it was an option for me.
The procedure hooks up the patient to an IV, transferring over COVID antibodies. And doctors at UAMS say it's supposed to keep higher risk people out of the hospital.
If you got this treatment, you had about a 1 in 100 chance of being admitted. The patients who didn't get this treatment had about a 1 in 20 or 1 in 25 chance.
Rolling up sleeves and getting the treatment is nothing new, but what is the number of people that now qualify.
We previously were doing 2 or 3 a day. Now we're doing 10 to 20 a day.
The FDA loosened patient criteria for the treatment, and UAMS says it couldn't have come at a better time.
It decreases risk of progression to hospitalization or death by over 70%.
Karen Sullivan is one of many to get the infusion.
Whatever I could do, I said, I'd be ready to do it.
She's happy it kept her out of the hospital so she can look forward to more days spent outside. Now, the big question is who qualifies for this treatment. There is a long list, but I'll go ahead and name a few. People over 65, people with diabetes or kidney disease. But again, that is a long list, and I've posted the whole list on our website. Now, doctors say also if you have questions to go ahead and contact them, or if you want to book an appointment, you can call your primary physician. Live outside of UAMS, I'm Jessica Rank for Fox 16 News.